So let me ask you this. I'm a person in need of medical care, right? What does this represent to me?
Well, one of the other unique aspects of the community health centers is our mantra is we treat anyone regardless of their ability to pay.
Per the USVA, Veterans Administration, and they project that there's about 12.8% of the veteran population in the country who have a hard time meeting medical care expenses. But what was alarming was that it's roughly 8% of all veterans in this country forego their medical care because they don't have the means to provide or meet the cost of maybe copays or just expensive care. What do you think about that?
Well, it's a sad commentary about our healthcare system in general, if you will. I mean, we see similar surveys around the general public, around certain population groups, and certainly to address the veterans. I mean, even with those numbers that are either foregoing or not able to access their health care, I mean, community health centers alone in Florida treated 17,000 veterans last year. Nationally, our community health centers treated over 400,000. So many of our health centers do have contracts with a lot of the military providers through TRICARE, VA, what have you. And so I, I'll admit, I think that we probably have, as community health centers, a little bit of an outreach issue in being able to reach our community and let them know truly what we are and what types of services we provide. So, to your point, not quite understanding who we are or what we do, I think that's the general consensus of the public.
Well, let's open it up. Who are
Sure.
you?
Florida community health centers, or another name is federally qualified health centers. There are 54 organizations in Florida. Now, among those 54 organizations, it is over 700 service sites. So a lot of our providers don't have community health center in their name and things of that nature. For example, you know, Evra Health in the Tampa Bay area, you may not know it's a community health center, right? So a lot of our organizations have taken an appropriate, culturally appropriate name, whether or not it's a geographical area or a certain population. So there's not a consistent name across the state. But those organizations, last year, we treated 1.8 million Floridians. And so we are the largest primary care network in the state. Now, each one of those 54 organizations are, independent legal entities, but under our state association, we certainly work together. We collaborate not only with other health centers, but with hospitals and other social services. Recently, a lot of the focus, both in Washington and throughout our communities, is the Food as Medicine initiative. And so we've got a lot more community health centers that are partnering with food pantries or even conducting and developing their own. We try to represent the community. And in fact, each one of these organizations has community members and patients on their board of directors. So those patients really control what services are being provided.
So let me ask you this. I'm a person in need of medical care, right? What does this represent to me?
Well, one of the other unique aspects of the community health centers is our mantra is we treat anyone regardless of their ability to pay. So we don't want just, and I say just, certainly a financial business model is required to maintain the services, but we don't want cost to be the preventive. You mentioned the survey around the veterans. A lot of them are prolonging or delaying their care due to the cost. You can show up without insurance at a community health center, and what happens is through an income verification, we will determine if you qualify for a state or national program, and if not, we base our fee based on income, right? So if you can't afford it, you essentially receive care under some other private service that will acquire, whether it's foundation or grant or what have you. We subsidize that care. So again, we just present at a health center, and the eligibility and the front office staff tend to work with folks in finding out the best avenue going forward. And again, we try not to let anyone leave. Most, if not all, of our health centers do have like a small cash copay if you have no insurance. But even in those cases, we're willing to negotiate.